estimated, this says 50%, I've heard estimates as much as 75% of people with hepatitis C don't know they have it. So in light of that, the CDC just this year made some changes in the screening recommendations. They're calling for a screening of all people born between 1945 and 1965 to check for one-time antibody screening for hepatitis C. Anyone who's shown to have positive hepatitis C virus should be counseled for alcohol abstinence and referred for appropriate care and treatment. The reason they've made this recommendation is more than 75% of people in America with hepatitis C are baby boomers. And if we're not screening these people, they're the ones that have had this disease probably for 20 to 30 years and are likely starting to have complications. The reason that we can talk about this and recommend screening is because there is hope for patients with hepatitis C. Our goal of treatment is to achieve what we call a sustained virologic response, or SVR. That is defined as someone whose virus is undetectable 6 months after they finish treatment. If we can achieve an SVR, we can show improved liver histology, reduce decompensation, and increase the benefits for long-term survival. The good news is we can now say that a patient is cured from hepatitis C if they achieve an SVR. They've studied patients 5 years and beyond, and nearly 100% of patients who achieve an SVR remain undetectable. So we can use the word cure now, and that's great news to our patients who come to us feeling like they've been given a death sentence. Treatment of chronic hepatitis C has progressed quite a bit, as Dr. Fletcher was saying. Initially, we were getting around a 10%, if we were lucky, cure rate, or SVR rate. And through the years, they refined the therapy. I started treating patients right about here in the early 2000s with pegylated interferon and ribavirin, which I will refer to as PEG-RIBA for simplicity. And we've been using that as the standard of care for patients with hepatitis C up until last year. And our cure rate, depending on genotype, would range anywhere from 40 to 80%. Not too bad, but still not good enough. With the release of the protease inhibitors last year, we're seeing much better cure rates from 8 different counties. So we've got quite a big geographic distribution that we cover as well. I'm the only one treating hepatitis C in southeastern Indiana. So we've taken some proactive measures to try to make sure we're doing that well. And including setting aside a certain time where we see hepatitis C patients to make sure there's always room in our schedule to take on new referrals or to follow up if having trouble. We have staff trained and dedicated towards supporting patients through therapy. We see them on a regular basis to make sure they're tolerating treatment well, and we're constantly monitoring their labs. As you can see, just anemia is a high-risk situation. In addition to that, the pure tracking of people who are getting ready to start treatment, receiving treatment for 6 months to a year, or needing a 6-month follow-up after they finish treatment, it's really hard to do. So when I decided to go back for my doctorate, I also chose to pursue a graduate certificate in informatics. And the whole focus of my project was to try to get our hands wrapped around all that goes into managing patients with hepatitis C. So we developed an interface with our electronic medical record. We use MedInformatics, which I think several practices use here, and this pulls directly from that database. So there's no manual entry. It all just pulls up into this screen. And as you can see, I can tell this patient's on week 12 of treatment. I can tell their viral count at week 4, it's green, means detectable, so we get to shorten treatment. Vaccine status, when they last had their vaccines. There's color codes to tell us who's due for what or overdue for things. And then I can click, like I have here at the CBC, and I can see the results over time for comparison. So his hemoglobin was 12.8. We're down to 9.7 in a few